Okay. Well, welcome everybody to Mindfulness Experience with access to Integrative Medicine, Health Institute, and the GW Office of Integrative Medicine and Health at the GW Resiliency Well-being Center. AIM is the first 501(c)(3) nonprofit in Washington, D.C. metropolitan area to provide integrative medicine services to patients who face financial barriers to care or terminal illness, regardless of their ability to pay. The office is a global leader in integrative medicine, focusing on professional development and community outreach. The center takes an evidence-based whole person approach to the health, wellness, and well-being. It serves the GW medical enterprise that includes the GW School of Medicine, GW Medical Faculty Associates, and the GW Hospital. Today we have yours truly, and also Mia Goff. Mia, let me make your co-host. Thank you so much for being here. Mia is an art therapist. She's going to tell us all about it. She's going to lead us into mindfulness experience. Unfortunately, let's send love and condolences to Victoria on passing of her mother-in-law or father-in-law. I missed that part. I think it was mother-in-law. So we're wishing her safe travels to her destination, take care of logistics, and support her partner. So, I don't know who requested this madness, but I am going to do that. So, you asked about evidence-based information on the honey. I don't know if you guys were really up for this. It's going to be quite interesting because I actually had to do a little bit of digging myself, and we'll cover that. So, that will be the first part. But before we get to the wellness part, let's do Q&A. I don't have any particular updates on COVID. I did look up that the flu numbers are finally going quickly down. I haven't seen any updates on COVID, meaning that there's no real updates that anything is changing. I think it's in a kind of a back burner background without much happening. I know there were some questions about the best vaccine in interim. I did say that I still think that the Novavax probably is the best choice. Unfortunately, I believe it's not easy to find. Outside of that, if you still need to get a shot, get whatever you can find. With that, let's do Q&A for a couple of minutes before we do the honey thing. What do you think of OTC pain patches? Okay, there's like gazillion of them. I can't answer this question. It needs to be specific. There are literally hundreds of OTC patches. So I don't know which ones. Do you want, means the one with CBD, the ones with THC, the ones with Voltaren, the ones with lidocaine, the ones with Tylenol. There's even Tylenol patches. There's all kinds of patches. So it needs to be specific. Um, Muscle relaxants generally, even if they do come in patches, I'm not aware of that. The patches is an interesting delivery mechanism. So the topical delivery system's divided into multiple different categories. So one of them is creams, of course, you're all familiar with that. And then there are patches. So why are patches potentially preferential? You can design the patches to the relief drugs very, very slowly. And so you can apply them once a day, for example, and have a very gradual release. So, for example, the fentanyl patches are more or less at this point standard of care because taking fentanyl this way, or any other opioids for that matter, by the way, can be quite advantageous exactly for the reason of pharmacokinetics. It's a slow release over time. There are a couple of problems with the patches. First, they tend to be a lot more expensive than oral drugs. The reason for that is it's much more difficult to create them because they require medication to be dispersed through the patch in a specific way. Plus, the patches themselves, for them to slowly release medications, have to have a very specific type of materials. So there's fascinating new type of patch, which is a ketamine. I know at least some of you are aware of that. We're still figuring out whether they work better than other types of delivery systems. But I think definitely patches have bright future. Which particular patches are going to be used for what condition, of course, time's going to show. But pretty much any drug you can think of can be put in a patch, almost any drug. So that's kind of really interesting question. In terms of pain patches, it doesn't matter. Any patch that delivered the medication that otherwise works for you could be tried. The most common over-the-counter patches are tend to be completely ineffective. So if you're buying them over the counter, there's nothing out there that's of any use, period. Simply because they don't deliver enough drug. Or if they do, they wouldn't be over the counter. They'll be prescription based. So lidocaine patches that are commonly used, they're all prescription based. You cannot obtain lidocaine patches without prescription. If you do, you're probably getting a very low dose or illegally. So that's that. All right, but it's a great question. Thank you for that. Okay, Randall, thanks so much for the information. So yeah, so it looks like we can still get Novavax, at least in some pharmacies. That's great. Thought on an AD nasal spray. Well, I've heard of them. New thing. Not sure I would still prefer them over the shots. The problem with nasal delivery, generally speaking, you're looking at a pretty small volume of absorption, so the volume of drug is going to be small. It'd be interesting to see how that would compare to pure high concentrated pharmacological injectable forms. I've seen it, I've heard about it, but I don't think that I would prefer that over a shot. You're still going to lose a lot of an AD this way, Steph, because you're going to blow your nose. Absorption is going to be a lot less predictable. Would that be, for example, better than using sublingual tablets of NAD, which are commonly available? Kind of hard to say. I think the nasal would be a little bit better because I think nasal volume is large and you can concentrate the fluid quite a bit. One of the common issues with any spray that you put nasally, they tend to be often uncomfortable because the way that they formulated, if it's in a pure solution without preservatives, it's going to burn, right? Because this is mucous membrane. So if you apply water, anybody ever sniffed the good amount of water into the nose that didn't have a salt in it or wasn't the ocean water know how uncomfortable that is, right? Because you're going to have severe burning right off the bat. So I would kind of wonder how they would create NAD sprays that wouldn't hurt because they have to put something in it. That something will potentially change the absorption and or breakdown time of NAD. So it may render it highly ineffective because it may not have a good shelf life based on that. But anyway, that's an interesting question. I don't think I can give you a better answer just because I don't have a practical comparison of other methods. What can you recommend for seasickness? Okay, so I love those C bands. If they're working for you, you can even just simply learn to press the P5 or P6 point, the pericardium point, which is right here. But seasickness bands definitely do work. Medications like Dramamine, for example, that are available over the counter. Not everybody responds to them well. You can try. Some people have side effects. Beyond that, there's not a whole lot out there. People say that sometimes you can try ginger. People say all kinds of things. Anything that you can use for nausea can theoretically work. There are obviously stronger medications which you could try. Is it worth it? If you're on a ship and you're going somewhere far, you're not going to keep popping pills every couple of weeks, a couple of days, a couple of minutes, right? So that definitely presents a challenge. It's definitely a big challenge for travelers, sea travelers, if you're on a boat that's not very large. If you're on a very large boat like a cruise, you don't need to worry about that, right? People generally don't get really Jennifer saying I'm wrong. Okay, so I'm wrong. Yeah, but generally the cruises claim that because the boats are very large, they don't follow the wave pattern as well. But of course, I'd be happy to be challenged on this. I've never been on a cruise. I can't stand the idea, so I don't know what to tell you. But generally speaking, the thinking is that on a cruise ship you're gonna have less nausea just because they're so big. Whether that's true or not. Of course, the commercial lines that selling the cruise tickets will tell you that that's not true, that they're safe, but that's their opinion. Somebody can Google this, whether or not there's a significant evidence to suggest that the larger ships produce less seasickness. I don't know. All right, we still have a couple minutes to do more Q&A. Rowan, I don't know if I answered your question to your liking. There was a muscle relaxer question. Muscle relaxants are very tricky. So there are two categories, two large categories of muscle relaxants. There is direct muscle relaxants, something like Flexeril or cyclobenzaprine, and then there's of course the benzos. Valium would be probably the most common muscle relaxant. Though they do tend to work. Valium is stronger than Flexeril. Valium is a controlled substance, can have some serious side effects, as any benzo can. Flexeril has a pretty mild efficacy, but it can be helpful. The issue is that they only work when in cases of an acute severe spasms. They're not going to do anything for chronic nagging pain related to the muscle deconditioning or some kind of neurologic. When, let's say, you have a sciatica of the nerve compression, those pills are useless. In fact, when you have a sciatica, nothing will work. The topicals will not work, oral pills will not work, Flexeril and all that will not work. You will need to treat that as a nerve pain. The only effective treatment would be either cannabis or some kind of intervention, whether it's a shot into the root of the nerve, or maybe even surgical intervention or really strong medications. So that is why definitely chronic back pain is so hard to treat, is because a lot of the treatments, they're not effective, period. And it doesn't even matter whether you apply the right drug. The problem is often with back pain is that the penetration into that area where you need the pain reduction is not happening very, very well. It's a more of a distribution of the medications problem rather than which drug works for what. That's a general comment, by the way. One of the big problem with pain in principle is if you think of a pain as a localized issue, your drug needs to be delivered there. If you're taking something orally, you get a systemic distribution. The amount of drug delivered to the area you're looking for may be minuscule or non-existent. And that creates a substantial complications. This is, by the way, why generally chronic pain treatment in this country doesn't exist, in my opinion. What exists in this country for chronic pain is a bunch of interventions that are scamming the society. Most of them don't work, strong evidence that they're useless. Surgeries are useless. There is no effective standard of care treatment for back pain. It doesn't exist, period. And it cannot exist because, in principle, all of these methods outside of manual approaches, physical therapy, chiropractic, osteopathy, all of them are scam. There's no mechanism by which any of these approaches can work. Yet there are studies upon studies trying to prove something. And if you go and carefully look into literature, zero evidence for anything. In fact, in 2017, American College of Physicians put out a very interesting guideline. They basically said no drugs should be used, period, of any kind. If you have no choice but give person a medication, give them Tylenol or Motrin. That's all they said. They said that the muscle relaxants don't work, opioids don't work, topicals don't work, injections don't work. They went through the whole thing of everything doesn't work. They recommended first line to be non-pharmacological treatments: acupuncture, massage, osteopathy, physical therapy, behavioral interventions, cognitive behavioral therapy, counseling, mindfulness. They literally put that as a first line of treatment. This is 2017, people. We're 9 years later, zero change in the system as a whole. None. In fact, we're doing more procedures than we were doing 9 years ago. Why? You don't get paid for doing counseling for back pain. You get paid if you're doing it $1,500 a shot of epidural injections. So, sorry, I'm giving you a very cynical and very negative answer, but yeah, that's me. Yeah. Yeah, and that's the problem. Like the other problem is you try to all these modalities and many times they don't work. Part of the problem with back pain, it's not a simple one condition. In one person, back pain can be related to deconditioning of the back's muscles. In another person, it could be because your spine is misaligned slightly. In another person, there could be nutritional deficiency. So you have a mix of gazillion things, and that's why the chronic pain of any kind requires a very complex, systematic team approach. And you can't just kind of say, "Oh, I'm going to go to primary care and they're going to fix it." Very unlikely for that exact reason, that often one person will not have enough expertise to handle the issue. So, all right, I need to finish up so I have a time for the honey as it was requested. Let's see where we are here with a couple more questions. Speaking of back pain, do you recommend wearing a back brace periodically? Yeah, it can definitely help. Danielle, that's a really good point. So mechanical things like that can be beneficial. There is some of those belts and braces that have magnets in them. Those are sometimes people also prefer. Definitely worth a try. I would say one thing is make sure you don't wear it all the time because it'll actually, believe it or not, weaken your back muscles. So you want to wear the brace for the situations where you know it's going to trigger the pain, but you still have to do certain things, and then use it for at least the amount of time you need to use it for. Can you give a presentation on most promising treatment for cancer? No, I cannot. It will take hours and hours on end. I can maybe take one particular cancer modality and discuss it, but no, this is way out of my pay grade. There are probably a few hundreds of promising cancer treatments. How many of them will end up being truly delivering good results? Hard to say. I think most of those promising medications are within the realm of biologics. So those are the drugs that are specific enough to cause less side effects. So they wouldn't be considered chemotherapy. They would be considered immunotherapy. That would probably be a more accurate statement. So I think there's most excitement about that. There's a lot of them already in the market on the market. Again, this is not my expertise. We can probably try to bring someone who does understand better cancer treatment, but I can only talk about some of the integrative modalities for cancer. There's lots of interesting things always for cancer, so we can, at some point, let me think about this, how to address this, Randall. Thanks for asking. Okay, let's do the honey, since I don't see any more questions, plus I have only about 10, 12 minutes left. Believe it or not, I do have slides prepared. Thanks to our friends, engines, or engines is in chess. So I guess here I would call it an AI. But it is my research, so don't worry about it. It's just, how do I do this? Okay, here we go. Okay, so, oh, you're not seeing the right screen. 1 second, let me put the other screen on. Okay, all right. So, well, why honey? Well, honey is actually a really fascinating substance. It's one of the most biologically active foods that we can consume on a day-to-day basis. It's not very expensive. Has a lot of therapeutic potential, particularly because it has so many different chemicals inside the honey, right? So it's not just the sugar, but there's a lot more than that. So let's take a look what's inside the honey. So there's a whole bunch of compounds that are called polyphenols, so things like quercetin and others. There's a variety of flavonoids. That's what give honey its own unique flavor. There's a number of organic acids, which are often considered to be part of that critical aspect of being antimicrobial and also anti-inflammatory. Honey is very potent anti-inflammatory. And of course, you're all quite familiar, there's sugars and also molecules that break down the sugars. So it's a very, very sophisticated compound. This is one of the reasons why you want to obtain the honey that's least filtered, that you want to be as most natural, so coming right out of the bees, and as least filtered and definitely not heated. Heated honey is garbage, and pasteurized honey is a total garbage, shouldn't be used for anything. Unfortunately, when you buy most of the honey in US, in the large commercial chains, they're going to be heated, pasteurized, filtered, or all three things combined. So you have to really be careful. The best place to buy honey, believe it or not, is straight out of the beekeeper's backyards or front yards or whatever. The term, I think, is apiary, which means place where bees live. So that would be the best. Now, of course, that's not realistic for all of us. You can definitely find a decent organic honey in a large food chain stores. But again, you need to be very carefully assessing who makes it and how it's processed. The raw honey, unfiltered, is the best. So antimicrobial properties, antioxidant properties, immune modulation. This is what we're going to talk about. And let's look first at antimicrobial. So this is the honey is a unique in the fact that it provides absolutely universal antimicrobial effect against every existing organism on Earth. There is no organism that is known to be able to resist honey, period. None exist. That includes viruses, that includes fungal infections, and of course, bacterial infections. The problem is, though, that often you need a very large concentration of direct honey application on the infection for it to work. Hence, if you're trying to cure your pneumonia by eating honey, you're being a little bit off the mark because you will never deliver enough honey to your lungs if you're eating it by mouth. And of course, you don't want to inhale the honey. That's not going to end very well for you. So, you have to think about particularities of a given infection before you can say, I am going to take honey for whatever, right? That's why you can imagine that the topical application of honey is so advantageous. Well, that's because when you're putting it right on a wound, you have the most concentrated delivery mechanism and it universally effective. That's why the honey is actually standard of care in the healthcare system when you're talking about wound infection. There are a variety of different honey-based medications. Many of you are probably familiar with what's called what is the honey called? It's a medi honey, what they call it. But it's a Manuka honey. Now, the interesting aspect is that's mostly commercial gig. Manuka honey per se is not necessarily any better than any other raw high quality honey. The difference is Manuka honey tends to have a higher amount of protein, so it has some additional unique immunogenic properties. But again, any high grade honey probably will be almost as good at the fraction of the price. So one of the maddening things for me is that they're selling Medi honey or Manuka honey at the premium that's just not justified. I mean, they're claiming that it's better when it's actually not. I mean, it's slightly better, but it's not better enough for them to get the price that they're asking for. So, wound healing, this is what we're talking about. There's a lot of evidence, actually, and that's why it is considered standard of care. So, if you look at the medical grade honey, they're used across the board in every institution, in every hospital. You may not see them dispensed as a honey because often honey is mixed with other delivery mechanisms like different creams. So, it's not like you're gonna roll into the hospital, they're gonna come to your table next to your bed and give you a jar of honey open, right? It'll be a medication. The Medi honey is just one of the trade names, for example. Huge evidence for respiratory infections. In fact, what's really fascinating is that it has been compared in randomized controlled trial to all the common cough suppressants, and honey is better than all existing cough suppressants. So we had a fascinating experience in Europe when we were in France. Peter had a flu and he was coughing pretty bad. So we went to the doctor because we were afraid he was getting fever 3 days being there. And so he got diagnosed with flu B. And the doctor said, yeah, don't buy any drugs. Go buy a honey. Like the French doctor said, we know that honey works better than any existing medications in the pharmacy. We don't recommend medications in this country. We only recommend honey for cough. So just FYI. So take it for what it's worth. Very interesting. There has been a surge of interest of using honey, not just to treat H. pylori and other infections in the gut, but really to optimize microbiome. Being that honey has a lot of antibacterial properties, suppressing certain growths in the gut without suppressing others has been very attractive. To the point where Dr. Frame and I almost got a grant from an industry to study effect of honey on microbiome. In the last moment, they decided not to fund us for some really fascinating political conversations, which I am not going to bore you with. But the point being, they wanted us to tell the public that their honey was better. Their honey was a lot worse because it was pasteurized, and we didn't want to do the trial with their honey, with the sponsor's honey. We wanted to get their money and study the honey from my own bees or from bees of my mentor, from basically just most unprocessed honey. But of course, sponsor wouldn't have it. They wanted to have, I'm not going to name the sponsor. They wanted to assess their own honey that they were making, and we said there's no point assessing your honey; it's not going to work because you're pasteurizing it. So, um, but yeah, so if you're trying to take a small amount of honey for support of gut microbiome, you're probably doing something right. Unfortunately, there's just not a lot of trials looking into that, but I'm sure it's a matter of time because there's a lot of interest in that. So, in short, those are the common indications. If you're gonna consume honey, probably one of the best way to do it is to take small amounts frequently, so maybe a teaspoon 3, 4 times a day. It is a sugar. It's a little bit lower glycemic sugar than a regular sugar, but it's a sugar. So if you take a couple of tablespoons of honey, guess what? You just took quite a lot of sugar. There's not a lot of contraindication. Honey definitely can and will worsen small intestinal bacterial overgrowth or any kind of microbiome disturbance in the gut if it likes sugar. So if you have a candidal overgrowth, even though honey is a suppressive, the problem is the honey is going to get absorbed. All the antimicrobial properties will be absorbed up above by the time it reaches the area where candida lives. There's not going to be a whole lot of antimicrobial property left. Remember, I started the whole conversation with the important premise that you have to deliver honey to where the problem is. Just like with any pain medication or any other any other treatment, it's best to always try to deliver it to the particular area. That's actually why honey is not used more widely in medicine, because it's not all that trivial. How do you going to deliver that to a particular area? So, one more thing, I'm going to stop sharing. I'm just going to talk about a couple other things since I have a couple more minutes. The belief is that the efficacy of honey in terms of many properties belongs more to a molecule called or entity called propolis or propolis, depending on how you want to say it. So propolis, is basically a bee poop, and they use propolis to seal off the hive. It covers different areas where bees are worried about. So, for example, if the hive starts to get molded, they will cover that area with a propolis. If they're worried that there's a crack in the wall of the hive that the air is getting through, or they're afraid that some other insects will get through, they'll try to seal it off with propolis. So propolis is really sticky. If anybody ever seen how it actually looks in life, it's really strong yellow material that smells very strongly, but that's what has the highest antimicrobial properties. So those of you who've been my patients may have heard me speak quite a bit. If you have a sinus infection, you're going to take a couple of drops of propolis tincture with tea tree oil, put it in a neti pot, and use it to wash your nostrils. So I'm a huge fan of using propolis. We always have propolis extracts, tinctures, or just the actual propolis from when I used to have hives in the house. And generally, that's why when you using honey, the higher the amount of propolis in there, the better antimicrobial properties it's going to have. Unfortunately, most of the regular honey you buy will have almost no propolis at all, because if you do put propolis in there, it's going to look really weird. In this country, people buy food often not for their medicinal properties, by conventional look. So the typical honey, the more propolis is in the honey, the less conventional it will look, right? So that's one big conversation point. Another one, when you're buying a honey, if you're buying a honey from beekeeper, do not worry if you buy crystallized, if you see crystallized honey. Almost always crystallization means great. Just remember that one word. Honey that does not crystallize is often fake honey, right? So there is about 50% of all the honey in the US market is fake honey. What does fake honey means? It means that they would take a honey and they will dilute it with a syrup, anywhere from 1:1 to 10:1 ratio. So the smell will be maintained, but the rest of it will be junk. That junk will never crystallize because the syrup in there will prevent from crystallization. If the honey is crystallizing, it's a pure honey. It's 100% pure honey and it's the best honey. The faster honey crystallizes, the better it is. It means that it has a much higher concentration of proteins and is generally considered to be the best. You can easily uncrystallize the honey, take the whole jar, boil the water. Don't boil the honey, just boil the water. put the jar in the water that's no longer boiling, that slowly cools off. In a couple of minutes, the honey will melt, and you won't heat it enough. You won't destroy any properties of it. You'll just make it liquid again. Frankly, I love personally how crystallized honey tastes more. I like that I can take it and spread it over the bread rather than, use it as a dipper or anything like that. But that's because just my preference. But if you don't like the crystallization itself, you can always decrystallize it in this way I just described. All right, so I think that's my time. Let's see if there's any last minute questions that I can address before passing it all to Mia. Okay, let's see, where is this? Okay, there's a lot of questions, more than I expected. All right, never mind. All right, we'll go through them quickly. All right, okay. Shout out to Fred Johnson, week 12 of the Beating Heart Moment. Remember, he's recording them on Monday. They get put up really quickly. Special kudos to our wonderful volunteer, Stephanie, who's here with us every week. Yeah, so Manuka honey, thanks so much for reminding me. That's the word I was looking for. Can you speak about how to store the honey? Yeah, room temperature. There's always question whether it's okay to leave it on the sun. I probably wouldn't leave it on the sun. There are there's flavonoids and active ingredients that probably do slowly degrade in the direct sunlight. So I'd probably keep it in the dark closet, just in the pantry. You don't have to refrigerate it. By the way, if you do refrigerate, it'll crystallize faster. That's actually a trick. Those of you who like the crystallized honey, you can just stick it in the fridge for a week. It'll probably start crystallizing a little bit faster, and if you like it that way. If you don't, definitely don't put it in the fridge. But it interestingly is, there's been discoveries of a honey back from ancient Rome still being edible thousands of years later. Honey is the only product out there that probably does not have any expiration date. At least we don't know what it is. So if you open there's only a couple of problems. So one, obviously, babies cannot have honey, right? Because of the botulism spores. And also, if the honey is in a tightly airtight container, when you open it, if you have a pup, that could be a problem. There could be some contamination and unneeded bacterial infection on top layer. It's highly unlikely, but it has been described. So there's no real reason to seal the honey completely. There's nothing theoretically can grow on it, so you can just cover it up with a regular lid, and you don't have to worry about closing it so tightly. What about sugar in the honey, especially for people? Yeah, and I kind of mentioned that it's a problem. So, if you're really diabetic, you have to be very careful. You may want, if you say you have a bronchitis and you want to try the honey for bronchitis, but you have diabetes, take less. Take a half a teaspoon every few hours. You will be taking sugar, so you have to remember that. It will impact your glycemic load and index and such. You need to watch for that. Unfortunately, there's no easy way to get around it. There's no such thing as honey without sugar. That would be a fake product. So, great question. What is the information on the pollen? Yeah, so the pollen is the protein that bees use to survive the winter. So they collect the pollen, and pollen sometimes ends up in trace amounts in the honey, making it very tasty or not. It's changing the taste to your liking or not your liking. But you can also buy a pollen separately. It's a great source of protein. Obviously, it's a very expensive source of protein. The only thing remember with the pollen, typically allergies to honey or to bees are really more allergies to flowers. They're really more allergies to pollen. So you do have to remember that. So you may tolerate the honey, but you may not tolerate the pollen. So you may be allergic to pollen. Just keep that in mind. Other than that, if you like the taste of pollen, great source of food. It's not difficult to buy. You actually can buy it in almost any store. There's like little pollen, I don't know, beads that you can call them or whatever, like little balls. So you can buy them in concert. But again, they're quite expensive per weight, obviously. When I use 1 teaspoon of honey in my tea, my brittle nails get stronger. Very possible, right? Because again, honey is a biologically active. It can help with a variety of different things. There's not a lot of minerals in the honey, but there is a little bit of some. So I'm not surprised Elizabeth, but by your findings. I've had a patch test today and it told me. Right. So, Rona, if that's the case, but if you can eat a little bit of propolis and you're okay, remember the test for allergy doesn't mean that you're unable to consume certain things. So, but if you tried Burt's Bees, which is actually a really good cosmetic product, if you try them and they have a honey on the label and you have a reaction, well, that's exactly what I was just talking about. Whether you're allergic to propolis or to the pollen, which you could be allergic to either or both, you may be a little bit out of luck. So you would probably be better off looking for a very purified products for honey if you want to eat something, the ones that don't have any propolis, and obviously don't use propolis directly, right? Because that's potentially going to cause you problems. Unfortunately, there's a ton of cosmetics that use propolis for a variety of reasons. Obviously, everybody knows that they have antimicrobial properties that, there's even some anti-aging properties of propolis that have been researched. I'm not going to go there because I don't think it's evidenced enough. So, all right, I think I got to finish up. Let's see. Product royal jelly. Yeah, royal jelly is the food which is fed to the queen, to the future queen. So it's a special food and it's much more high in protein and it's used for a variety of cosmetics. So yeah, that's a fascinating product. Deserves its own entire conversation. You want local honey. Yeah, so if you want trying to treat your allergies, which has been there's some evidence, the local honey within area where you live would be the treatment. It looks like Cecilia is giving you an information about honey, right? Meeting has great, great. Well, thank you for that. Bee pollen, right? Okay, Mia, thanks so much for being here. I'm so excited to see your presentation. Even if you go a little bit over, that's perfectly fine. Folks will be staying here. Those of you who are my patients, as usual, if you need to talk to me, stay after, and we'll have our time till around 3:30. Thank you again, Mia.
Hi guys, thanks so much for having me. I, as I said, like I wish Victoria could be here, but that's all right. And I am the art therapy intern with the Resiliency and Well-being Center, which is the department of GW School of Health and Medicine that Victoria is a part of. And I am their art therapy intern. And I'm also a second year art therapy student in the GW master's program here. So if anybody has any questions about art therapy, if you've never heard of it, if you're curious what that looks like in different ways, like absolutely, please let me know. I love answering questions. I love talking about this field. Um, I'm kind of a nerd about it. So if you have any questions, please let me know. But I think recently I feel like art therapy's kind of been big because I've done some things and I've been like, oh, has anybody heard of art therapy? And people really have. But if you haven't, like, please do let me know and we can definitely, and I can definitely answer whatever questions you have. So, what I have prepared for you today is a little bit of a mindfulness tracing activity. And this can be done. I think Janice sent an email saying, like, try to have like an object that can like be pushed around on a piece of paper. I had a pebble, but I don't know where it went. So, I'm going to be using an air tag that came out of my purse. You can use a house key, you can use a pen cap, you can use a coin, anything like that. And what we're going to do is we're going to use our writing utensil. It can be a pen. If you want to get really fancy and use glitter pens or markers, or I guess you could try a paint and paintbrush, but that might get a little bit messy. You could, but pen, pencil, that's all you really need right now. Yes, let me see if I can get my mic settings um adjusted. Let me see here. Let's see if that's any better.
We do hear you well,
Okay.
so I'm not sure if somebody not hearing, maybe it's your volume.
All right. Okay. I have the noise, like the background noise canceling turned off, and I know for some speakers that like doesn't work well. So let's hope that works for everybody now. So what I'm going to do is I'm going to invite everybody, and as I'm going through this, if this isn't sitting with you, if you don't want to do this, if you just want to like watch, if you're just interested and just want to like be an observer, or you want to doodle, absolutely do what speaks to you right now. But I'm just going to invite everybody to take a deep breath in and out. I don't know about anybody else, but I know when I'm sitting on Zoom, I tend to have a bad habit of bad posture. And so I find that like taking a deep breath in and out kind of just opens up our bodies a little bit more. And as we go through this, I have noticed the more I do this that not only myself, but other people have a tendency to hold their breath. So if you do notice that, and I'll be reminding you as we go through this, try to just keep breathing at your normal pace. I normally do this on my iPad, but it's not working right now. Oop. So we're going to try this. But basically what you're going to do is put whatever object you want. I have an air tag. You can use house key, penny. I had somebody pull out an ibuprofen one time and use that on their paper. So anything pushable by a pen or pencil will work. I'm going to use a red pen so everybody can hopefully see this better. And what you're going to do is you're just going to kind of push your object around your paper for a couple of minutes. See where it wants to go. Is it easy to control? Is it not? If you find that you're getting really frustrated, I invite you to take another deep breath in and out. This is non-serious. No, but nothing's gonna catch on fire. Nothing is weighing on this. This is just fun in the moment on your piece of paper. If you are holding your breath, take another deep breath in and out. And let's do it for another like 45 seconds. How does that sound, everybody? And whenever you're ready, find a good pausing point. So this is what my sheet of paper looks like. I hope that everybody can see that. It's a little crazy, a little out of control. Did anybody, you can unmute yourself or you can throw it in the chat, but did anybody find this unusual, frustrating, fun, silly? Yeah. Oh, it is like an Etch-a-Sketch. Oh, that's a really good one. Yeah. And there's not really like controlling it either. Like you try to get it to go one way and then it decides it's going to go a completely other way. So now I'm going to invite you to kind of look at your picture, look at your drawing. And we're going to do a little bit of kind of like cloud watching where I'm going to invite you to look at your paper, look at this abstract, silly, fun shape that your object and pen created, and see what objects, things, people, words pop out to you. Circle them, color them in, jot them down, connect them. Do whatever speaks to you. let's take, let's just take about 2 minutes and see what you find. If you have other coloring instruments with you, decorate. Why don't you everybody take another 30, 45 seconds. Find those last shapes, things. If this is not up your alley and you're bored out of your mind crazy, it's almost over. Oh, wow, that's amazing. Okay, wait, how do I unpin this now? I didn't mean to do that. I'm so sorry. To be completely honest, I really haven't used Zoom much since 2022. So this is a bit new to me. Let me see if I can figure out how to unpin. Oh. Okay, I have no clue what's happening. Give me a moment. Video. There we go. All right. Sorry about that, everybody. How was this for everybody else? So, this is kind of like a fun intro art therapy thing that it just gets your mind moving in a different direction and gets you to utilize other parts of your brain. As I said, I'm a big art therapy nerd, and all of my professors are too. And we talk about like neuroplasticity all the time. And basically, our whole goal in art therapy is to get you to look inside of yourself, feel your body, understand what you're feeling, and then also try to get you to use those different parts of your brain that you're maybe not using on an everyday basis. And this is one of those things that's kind of fun. It's a little bit childlike and it's very easy. And it's a good way to kind of pull your attention from inside of your thoughts going all the time into your body and into the outside world in a non-serious way. And this is something that can be done, and we call it like it's in your toolbox. So it's really good for like if clients. I've had clients that like my teenagers when they're at school, they're really stressed out. They're going into a, like something Um, this is a tool they can pull out. They can pull a coin out of their purse or a pen cap or anything that they have and do this and take a minute. It can take anywhere from 5 seconds to 2 minutes to 20 minutes and gives you a whole other part to focus on and can kind of help to make some of the stress and anxiety lessen a little bit of what's facing you in the like looking right at you. Yeah. And it's sometimes you don't know with drawings too that I'm reading Jennifer says, I wish I would have left my drawing alone. And that is definitely something that I think a lot of us have all experienced in different things, whether it's writing a paper or drawing or a recipe. Like, oh, I wish I wouldn't have added that extra spice. But that is just part of the process. And this is non serious. Nothing's being set on fire from this. And next time, you have a little bit more information about what you as a person are looking for in your art and in your creative experience and expression and what you want to do with that moving forward. And this is great because you can tear it up. If you really need to get your frustration out right now, if you got a lot going on and you want to get it out, I invite you, tear that piece of paper up, throw it away, crumple it up. Or if it brings you a lot of joy, save this. Keep this as a little reminder of the joy that you felt right now. And when you need to remember what that feels like in the future, pull this out. This is your little reminder card. And yeah, you can do this exercise anywhere and everywhere. Thank you guys for participating. I really appreciate that. The process reminds me of a spiral journal exercise from another part. Yeah. Yeah, the spiral is there's a lot of different exercises and many different forms of therapy with spirals, and it's definitely a lot like that of finding. Another one that we do a lot is we'll have people kind of draw all the way down and just keep going and going and going and going and going, and then look at it and do this and pull different things out and see what they find and what comes up for them and how is that sitting with them and what emotions does that bring up and how can we process that moving forward. And it's a great like mental exercise for yourself as well. All right, thank you for sending that link. Does anybody else have any other questions, comments? And I think I'm scheduled with you guys again in April. So I know that he had said the honey had been requested. So I'm sure there's a way of like, if there's something that you guys are interested in that's art therapy related that you guys want me to bring up next time I'm here, I think there's definitely a way that message can get passed along to me through Victoria or whoever. So definitely don't, like, if something piques your interest, let me know. Does anybody have a creative practice that they use right now that brings them a lot of joy? I'm a big fiber artist, so like knitting, crocheting, felting, beading. That's a good one. Beading's addictive too. It's fun. You get going and you just want to keep going. These are all great. Like anything that like you can do to just like exercise other parts of your brain and life makes life more interesting, makes it fun, and gives you other part to kind of focus and breathe down more or pull into your body more. Embroidery. I love to embroider. Embroidery is a great one. I do a lot of embroidery with my when I had teenage clients because it's really amazing to like you go up, you breathe in, you go down, you breathe out, and that repetitive process can kind of pull you into something. Same with like beading, that art therapists call the flow state, and it brings you into this like meditative state where your mind and body are kind of connected in this weird fun way. I'm not describing it super well, so I apologize if I'm confusing anybody. But yeah, those are really great. I love all that stuff. I'm so glad that you guys have that. Some of you guys have these practices. Quilting. I am forever impressed by quilters. You guys create some amazing things. And so, yeah. Has anybody ever been a part of like a community group or like a sewing circle or a quilting group? And that's like held a part of their life at any point? Oh, punch embroidery. Yeah. That's a fun one. That's one I've always wanted to learn. Yeah, sewing circles are really hard to schedule. I mean, it's so hard. Everything is hard to schedule. And your to do list gets full. But I've found that there's a lot of online community in different areas all over the place. From whether it's, I know my father in law is really into beekeeping and he's into all of these different online communities. And I've really found the same for myself inside of the different art communities. And even when my schedule is chaotic and crazy, and I have had clients that say the same thing, even when they're not creating or able to do something, it gives them an opportunity to connect with somebody on the common interest. And so, Facebook groups and anything like that around crafting materials, things like that, can be really great ways to kind of pull in different areas of your life, also. All right. I think that we're at like the end of my time here. Thank you guys so much for having me. And in replace of Victoria, I those are big shoes to fill. She's pretty great. So I appreciate you guys putting up with me in the meantime. And I will see you guys again in April. And yeah, yep, April 10th. And I'm gonna invite everybody because this is my whole world in art therapy to just take another deep breath in and out. And yeah, thank you for being here with me. Seriously, I know you guys were planning on being here with or without me, anyways, but I appreciate you guys letting me have some of your time.
Mia,
Mia,
thank you
thank you
so
so
much.
much.
So wonderful having you here, and we'll see you on April 10th. Everybody have a wonderful weekend. I am going to stop recording here.